Good morning. This is Dr. Bill Wyatt again here, and I wanted to discuss something here that is a very important thing to understand if you're going to do orthodontics and straighten people's teeth out. It's just a principle that happened up on me without my knowing. In other words, I put some braces on a young man back in, I think, 71 or something like that, who just really didn't need them all that bad, but he had this real deep bite, and he was a kind of a hippie type guy, and he just disappeared. I think I saw him one time after I put the braces on, and he just didn't show up. And then we wrote him and things, but he never came back in. But then finally, 6 months after we started the case, I maybe have seen him once before that, but then it was 6 months he returned, and the reason he came back, he could not get his front teeth together out here. And the man started off with a deep bite with his upper front teeth covering his lower front teeth. And the principle of what happened here is something that everybody that's doing orthodontics should understand, so you can control the vertical height of the lower third of the face here and keep from increasing it. When you intrude teeth like this, you can make the vertical distance too much, and you mess up the looks of the person, and it's hard to close it back down again after you go. Now, this same principle is used in this carrier appliance. It's old. They look like somebody picked it up, and even Tweed and other people have used this principle to some extent. So I'm going to go through this and not take any more time than I have to. Let's see, I'm going to have to get my little pen going again here. And my pictures are not too great, and this is after we're into the case. But this young man came in, and he had this deep bite, which you won't see until I show it to you on the models. And then he came back. He could not touch his front teeth together in here. We put two little wires in his mouth. I mean, this is about 0.16 wire. The pictures are not the best in the world. I don't know what happened to my little marker. It disappeared here. But anyway, these wires are not the strongest in the world, and we've got little loops in them back in the back here, both upper and lower wires like this. It's about an 0.16 or maybe an 0.1, a little bit bigger than that, but it's not a very strong wire that we put in this young man's mouth. Now, this is the way his teeth were when he came in. The upper teeth right here, closing over, the lower teeth would probably be up in something like that, up in the mouth. I think I've got a picture showing from the back side of it. In other words, the case was closed down like this, and he wanted to open this up. Now, when you have a closed bite, you can't chew properly. You have to chew straight up and down, more like they say, like a dog bite. And it's better if you can slide from side to side. It's about 4 times more efficient in chewing food if you can just slide your jaw back and forth. So you've got to have just a certain amount of over bite and overjet here to be able to do that. Now, when you slide your jaw forward and bite with your front teeth out here, this opens up your bite. You slide it forward. Your condyle, let's just draw a fossa in here, and maybe the condyle would be setting in something like that. When you slide your jaw forward, the condyle moves down on the ridge of the fossa, and this separates the teeth back in the back of the mouth. Now, this principle, you just need to understand this. Now, when I reach out here and bite my front teeth together like this, there's nothing touches except where my front teeth come together and where this condyle is moved out, and it'll be touching in this area here and in the front teeth when you bite something out here. So that's why you never bite anything really hard unless it's a desperate situation with your front teeth, because it puts more pressure on the fossas back here and can actually damage the disc that fits over the condyle in this area right here. So as you bring your jaw forward, this pressure is here, and of course on the other joint on the other side of the mouth. Now, to get this to open up where it's proper, you just need about a couple of millimeters or so of overbite and overjet, and you can slide your teeth back and forth, and you can slide them forward and bite with your front teeth, and there's nothing touches in the back side. Now, if I slide my jaw to one side, I slip over here, then this condyle will come out on the eminence up here, and the teeth over on this side will come in contact, and these will not come in contact. Now, you just don't think about all this when you're eating with this, but when I bite over here, like this condyle moves and comes out on the fossa here, and it doesn't on the other side, so I can chew on the left side and have a gap over on the right side of the mouth. And that's the way the thing works in here. Now, if I'm going to try to open this guy's bite up right like this, and I'm going to, let's see, I'm going to erase this and clear it up. And so we put little arch wire back here. We banded these molars and had the arch wire that went up like this and came over the other side, had a little spring like this, and I brought it down and attached it to these 6 anterior teeth like that. So this wire itself is trying to pick these teeth up. And I want people to understand this, so I know if you are doing a lot of orthodontics, this is beginner stuff, but people need to know it. There's a lot of them that don't know it. Now, if there's a force trying to pick these teeth up, there's also an equal amount of force trying to push this tooth down back here. If something goes in one direction, something will go in the other direction. So the force on this wire, when I tied it up on these teeth here, brought it down, was trying to push these teeth down as it raised these teeth up. Now, I saw this guy, and we put this in. We did the same thing on the bottom arch down here. We had bands on the teeth, and so we had an arch wire that was down like this. We brought it up and tied it to the lower anterior teeth, and it was intruding them the wire is intruding these, and it tends to make this tooth go up in this fashion. So this molar's tending to go down, this one's tending to go up, and if you didn't have any other force in here, whatever these two teeth do come together over here, that means you're going to increase the vertical height of the face. In other words, this lower third of the face. If you take a beautiful facial structure and increase this very much, it begins to look terrible. It really, if you increase it very much, it really makes the person look bad. So you need to be able to open people's bite, either I'm talking about opening dental-wise or opening it skeletal-wise in here without actually increasing this vertical height of the face. Now this may confuse you, but I hope, and I know people doing orthodontics don't get confused with this if they know it to start with, but if you're not, don't realize this happens. All right, let's go on further in here. Now I do have a picture here with where the lower anterior teeth were batting up almost into the gum of this person. I just shot this picture from the backside, and here is the date that we did this. It was 4 of 1971. Now, I started doing nothing but orthodontics in 1970. So this was right after I really got, I gave up the rest of my practice. I gave it to different people I knew that would take care of them, and I did nothing but orthodontics after 1970. Now, all right, this guy is, the lower anterior teeth are right up against the tissue in his mouth. Now, you cannot chew like this, like we're talking about, with your teeth that high. You slide over here, you hit here, and you can't move your tooth like that. So you tend to chew straight up and down when you have a closed bite like this. All right, he didn't like that, and he wanted to straighten it up. He wanted to intrude these teeth down here. They would go down in this direction. The front teeth would be going up here, and now we'll come in to have just about 2, 3, 4 millimeters like that. Now back in 71, we had nothing to put on the teeth but bands, and so we banned all these teeth. This is from 3. This is the cuspid, lateral, and the centrals. Cuspid, lateral, and centrals in here have bands, and we band the 6 teeth on the bottom. Now this band had some effect, like he'd come down and hit this, and he couldn't close his mouth all the way to gather as he was when we started. And now we're going to put these 2 little wires in like that, and we're going to bring them down and tie them to these teeth right here. And I think I saw him one time after I hooked this all up. And then the young man just disappeared. We could reach him at all. He was gone. And in 6 months' time, he came back in the office, and one of the ladies at the desk said, "Dr. Wyatt, you ought to come look at this man." Now, people do things to themselves, and if you've got some records on it, you learn an awful lot in here. The force going in this little wire right here intruded these teeth. It's 4 times harder to push a tooth into the bone or make it intrude as it is to extrude a tooth like that. And this is a lot of teeth in here played against two molars over here on this side. Same thing down here on the bottom. But the molar teeth didn't move. They hardly moved at all. And that's the principle of this carrier deal. They attach something and put some class 2 elastics on it. That has been around for years and years. Somebody that's pretty smart figured out how to make a lot of money out of it, and so they did. So this opened this young man's bite. Now, if we get back here and look at the tooth really close, you'll notice that the front cusp, in other words, the back cusp, don't seem to be touching, but the front cusp do. So if you took something and put in here, ran it in this, and you pulled it down here, it would tend to take this tooth that's up here and cock it in a forward direction, and so it hits right here. Now this occlusion of the teeth biting together with the muscles forcing these teeth together did not let these teeth extrude at all. That came down, and if you really want to close the bite some, you can come in here and bond acrylic on top of these, and it'll even chew more on them, and it'll close. Actually, you can reduce the vertical height of the face like that. So this principle is the thing that I want you to understand and know. So whenever you are doing something, a deep bite case, you can take people with their front teeth way down here and close them, bond something on it if you don't want to open the bite. Now, if you want to increase somebody's vertical height of the face, if their chin's too close to their nose, you can leave a space in here where the teeth don't even touch by putting a bite plate in front of the mouth. And now you're pulling this force on here, pushing this up, and you've got a gap in here. The teeth aren't touching at all. Then these teeth will move toward one another, and you can increase the height of the face. You take some people that look like their chin's going to come up to their nose. You can increase the vertical height, or you can decrease it, or you can keep it the same. And that's something you need to know. Now, people say, they'll tell people that first getting started in orthodontics, the high angle cases, that we call the high angle, somebody that's running around looking like that, leave them alone. Let them go to somebody else. If you start working on them and you don't know how to do it, you'll make them even higher, and that looks even worse. And so learn this, and you can do whatever you want to in opening deep bite cases. Let me erase some of this and go on and see. Now you look at this as close as we could get. This is all that we had back in 71. See, the teeth are touching. This tooth is coming in here, and this one is here. And that's the back part of the teeth, though, is not touching back in this area. And so these teeth are coming in something, they're leaned a little bit, but not very much. In other words, you can control the vertical height of the face of a person. If you want to reduce it, bond something on top of this, and the person biting on these will depress these teeth, and they'll bite a lot more, and you'll intrude your anterior teeth, or you skeletally open the bite too. So I hope this means something to people who are looking at it and wanted to turn out some good-looking orthodontics, you can do that. So here, this young man is, our pictures are not in focus. I thought they were better than this, but anyway, we had these banded upper teeth. These teeth went up. These teeth did not move hardly at all right here. These molar teeth. Now let's see. And that's where we started from. And you can see this way as we started when it was down like that. And he came back in after 6 months, not because he was worried about chewing or anything, but, well, actually he did, because he said he couldn't bite through a hamburger or a sandwich. His front teeth just didn't go down there. And when he came in, they were down really far in his mouth. So here he is after 6 months. And so we didn't have to do a whole lot to this case to finish it. It almost carried it to where we wanted to finish it. And I want to say thanks for watching, but learn this principle. That's what I'm hoping for you to do, wherever you are. This YouTube stuff is fantastic. We can learn something. You want to tell everybody, you want people to learn it everywhere in the world, then this is happening. So I'm going to say goodbye, and I'll go over and close this out now.